Dementia versus amnesia. Have you ever watched a movie where one of the characters loses their memory completely? So much so that it becomes very difficult for them to recognize their loved ones and even sometimes themselves. Memory loss can happen due to several reasons, and it has several forms. Memory loss is most commonly known as a sign of dementia, but most of the time, all conditions of memory loss don't qualify for the development of dementia. Amnesia, on the other hand, might sound a lot similar to dementia, but has a lot of differences with it. In this article, we will look at each of the conditions separately and will understand the differences between the two. Dementia is a chronic organic mental disorder which may be characterized by symptoms like impaired intellectual functioning, impaired memory, impaired judgment and impulse control, impaired reasoning and abstract thinking, lack of personal care, exaggerated and rapid changes in mood, exaggerated reaction to minor stressors, thought abnormalities, problem holding in urine, or stool disorientation in time, place, and person. Impairment in all or at least a few of these functions can occur globally, causing difficulties leading day-to-day life. However, there is no significant impairment of consciousness. These signs and symptoms need to be present in an individual for at least 6 months, with no other disorder explaining these symptoms. Although both disorders are often confused to be the same because both of them are characterized by memory loss. Dementia and amnesia are both distinct disorders. In dementia, along with memory loss, there is an impairment in intellectual abilities and cognitive processes followed by a lack of self-care, disorientation, and exaggerated and rapid changes in mood and behavior. Amnesia may differ from case to case, and the memory loss in amnesia can take many forms. Dementia is characterized by a global loss of higher brain functioning. Amnesia is more of a memory impairment. If diagnosed and taken care of, amnesia can be treated, but dementia is a permanent condition, causing progressive memory loss. Dementia involves an overall impairment of cognitive functioning, whereas amnesia primarily exhibits memory loss without evident cognitive decline. Causes of dementia include heart disease, genetics, and stroke, while amnesia can result from brain injury, concussion, PTSD, or substance use. Dementia tends to be of high severity, often becoming irreversible, while amnesia may have relatively low severity and can be reversible in some cases. Dementia typically manifests in older ages, while amnesia can appear in youth. Dementia progresses slowly over time, whereas amnesia has a sudden onset.